I can't possibly go through everything that's going on at Littleton Adventist Hospital. So the number of neuroscience initiatives is really, truly staggering. The advances that we will have, which will be directly as a result of the Brain Matters program, will be a better MRI to get 4 times better picture resolution. We will have the ability to color code the tumors at the time of surgery, and the ability to figure out where the control signals to the body remap to in a particular tumor, so that we can take these tumors out more safely. So we have some advances in epilepsy treatment. Just to sort of recap, we have things called phase 1 and phase 2 monitoring. So this hospital currently has, and is one of the few hospitals that has phase 1 monitoring. What that means is we hook somebody up to an EEG, and we keep them in the hospital while we take their medications off. They may end up having a seizure or two during that period of time, or they may have changes in the monitoring. Those changes can then be used to identify where in the brain the epileptic seizure is coming from. The idea is that we could do surgery to remove that area and therefore cure them of their epilepsy or reduce the odds of having epilepsy. This only changed probably nationally in the last 3 years. We'll have the ability to do this here. Part of the Brain Matters program is something called depth electrode placement, and typically placed with a robot. So maybe a different robot than we've used for deep brain stimulation, and something that's going to be part of why we're doing all this fundraising. The idea here is that instead of opening up the brain, I can do a simpler surgery, and I can get way more information by placing electrodes deep into the brain at specific targets. The patient goes to sleep, the robot already knows where to put the electrodes. Line the robot up, put an electrode in, put another one in, put another one in, put another one in, and then take them up to the intensive care unit with a lot less risk to the patient and with a lot more information. So now, in the past, all this would have led up to a resection. But now, we can do the entire resection surgery through a pinhole and send somebody home the next day and potentially be seizure-free for the rest of their life. And I've done this here, and it's called laser ablation. The last patient I did that like this basically didn't want to talk about it anymore because he goes, having seizures 3 or 4 times a week was my old life. I did that case a couple years ago. He's never had a seizure again. Went home the next day, and his only incision was this big, right back here. Deep brain stimulation is used to treat these diseases currently. I've done all of these. We primarily use it for Parkinson's essential tremor. It can work for obsessive compulsive disorder. It can be used for dystonia, where you'll have somebody who walks and they maybe turn a foot inwards, and they probably oftentimes have several foot or ankle surgeries before somebody realizes that it's actually the brain causing that, not the foot. Neuroscience, you can see, is heading in a very, very heavy technological direction. And there will be only a few centers which specialize in all the things that neuroscience can offer. And Brain Matters is about making Littleton Hospital, it's about 2 things. One, it's a recognition that we are a center. So we became that just due to the people that were here. But it's also taking that and making it go further so that we can be recognized nationally for what we are.